So today we are going to take a look at a series of points on the ear called the master points. They are called the master points because in auricular acupuncture and, well, acupuncture in general, the rule of thumb is to locate points that are tender upon palpation. So if you take a probe and palpate the ear, you're looking for points that are more tender than others. This is what we call active points. And so the master points are the points that have been found to be in studies to be the most active or the most tender. So there are 10 of them, and we're going to go over specific point location to locate those 10. But know that even if you're at home and you're all alone and you're following along and kind of learning where these points are, you can simply begin to massage your own ear. Your ear is like a direct gateway to your nervous system. The ear itself interfaces with 3 cranial nerves, one of which is the vagus nerve. And the vagus nerve helps to regulate our parasympathetic nervous system, which helps us move from fight or flight into rest, digest, repair. So we're going to go ahead and locate these points, and then we're going to put some ear seeds on Tom just to kind of show you where they are. And you can follow along if you like. If you have a friend with you, you can kind of practice on each other. And we're going to get started. Okay, so the first point that we're going to take a look at is point 0. This one is also called the ear center, the point of support. The umbilical cord, the solar plexus are reflected within. The location is on the notch on the helix root, just as the vertically ascending helix rises from the more horizontal concha ridge. And the function of this point is the geometrical and physiological center of the whole ear. That would have been an easier description of the location. It brings the whole body towards homeostasis, which means balance, producing a balance of energy, hormones, and brain activity. It supports the actions of other auricular points and returns the body to the idealized state which was present in the womb. On the auricular somatotropic map, point 0 is located where the umbilical cord would rise from the abdomen of the inverted fetus pattern found on the ear. As the solar plexus point, point 0 serves as the autonomic brain that controls visceral organs through peripheral nerve ganglia. Okay, so here is point 0. So sort of right on the center of this concha here. They make it look like your concha ridge ends here, but it doesn't. It extends on through, and so it's right at the center. All right, so we're going to feel around on Tom, and we're going to kind of feel into point 0, which would be right in the center here. So let's go ahead and tender there.
Mm-hmm.
Okay.
Mm-hmm.
Okay. So we're going to go ahead . Okay, so we're going to place this ear seed on point 0. So So right in the very, very center of the ear. And that is the first master point. So the second point is one that we've done several times in other videos, and this is called Shen, Spirit Gate, Divine Gate. This is located superior and central to the tip of the triangular fossa, between the junction of the superior crus and the inferior crus of the antihelix. It is not at the tip of the triangular fossa, but slightly inward and slightly upward from where the triangular fossa descends from the superior crus toward deeper regions of the triangular fossa. The purpose of Shen is to tranquilize the mind and to allow a harmonious connection to essential spirit. This master point alleviates stress, pain, tension, anxiety, depression, insomnia, restlessness, and excessive sensitivity. The Chinese believe that Shen affects excitation and inhibition of the cerebral cortex, which is similar in function to Nogier's second phase Thalamus point, localized to the same area of the ear. Utilized in almost all treatment plans, including auricular acupuncture analgesia for surgery, Shen was one of the first points emphasized for the detoxification from drugs and the treatment of alcoholism and substance abuse. It is also used to reduce coughs, fever, inflammatory diseases, epilepsy, and high blood pressure. When it is difficult to find tender or electrically active ear points, stimulation of either Shen or point 0 increases the reactivity of other auricular points, making it easier to detect them. Okay, so Shen is right here, so let's go find that. All right, so we're going to feel around for Shen. So Shen is going to be right at this sort of upper outer edge of the triangular fossa here. Tender? Okay. Okay. Okay, so we're going to place Shen. If you're following along at home, know that it's more important to get the ear seed on the most tender area than it is to have the location perfectly match the book. So just do your best to kind of feel around, palpate around, take your time, and find the most tender spot, and then go from there. So the next point is the sympathetic autonomic point. This is located at the junction of the more vertically rising internal helix and the more horizontal inferior crus, directly below LM1. It is covered by the brim of the helix root above it, thus making the ear point difficult to view directly from the external surface of the ear. It can be found on the vertically rising internal helix wall, on the flat edge of the inferior crus, or the junction where the two meet. Okay. So sympathetic autonomic is right here. And so then on the chart, whenever there's a square instead of a circle, the square indicates that it is sort of hidden underneath folds of skin. So the sympathetic autonomic point is sort of like inside the ear here. So we're going to kind of find that on Tom and see if it's tender. So if you're at home, you can palpate this point simply by kind of like sticking your finger in here and kind of rubbing it like so. You can also sort of like pinch the outer edge of the ear in this area to activate the sympathetic point. So we're going to kind of feel in here for Tom. Tender? Okay. 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 So then when I place an ear seed on this point, we are not going to be able to really see it after it's placed, aside from the edge of the little mustard seed here. Okay, so this one is in, but you can't really see it anymore, so you'll have to remember that. And let's read what it does. So the master point sympathetic autonomic balances sympathetic nervous system activation with parasympathetic sedation. This point is the primary ear locus for diagnosing visceral pain and for inducing sedation effects during acupuncture. It improves blood circulation by facilitating vasodilation. It corrects irregular or rapid heartbeats, reduces angina pain, alleviates Raynaud's disease, reduces visceral pain from internal organs, calms smooth muscle spasms, and reduces neurovegetative disequilibrium. It is also used for the treatment of kidney stones, gallstones, gastric ulcers, abdominal distension, asthma, and dysfunction of the autonomic nervous system. All right, so that was a sympathetic autonomic, which is sort of just right in this inner part of underneath the fold here. All right, so the next one is the allergy point. This one is on the internal and external sides of the apex of the ear, and this leads to a general reduction in inflammatory reactions related to allergies, rheumatoid arthritis, and asthma. It is used for the elimination of toxic substances, the excretion of metabolic wastes, and treatment of anaphylactic shock. In Chinese medicine, the top surface of the allergy point is pricked with a needle to reduce excess qi, or it's pinched to diminish allergic reactions. So the allergy point is right here, sort of underneath that skin fold again. And so let's feel around on Tom. So at the apex of the ear, sort of underneath. Tender? Mm-hmm. Yeah. Okay, we're just going to keep doing a little acupressure here. So bear with me. Mm-hmm. Okay. So that is a reactive point for Tom. If you didn't know, there is a sort of mind-body component to allergies, meaning that allergies can be connected to our emotional self. So if we have childhood trauma, if we have, certain personality traits that create a reservoir of unfelt emotions underneath the surface, so like perfectionism, goodism, always wanting to do the right thing, always wanting to be perfect, that can lead to a sort of internal turmoil that leads to like hypervigilance of the nervous system, which can also lead to hypervigilance of the immune system. And so this allergy point sort of communicates directly with the brain and helps us sort of tell the brain, like, hey, it's okay. You don't have to protect me so voraciously. Thank you. Okay. So that is the allergy point. It's essentially at the apex of the ear, but sort of underneath the skin fold here. And if you don't have ear seeds at home, you can simply just pinch that top of the ear like that. If you're dealing with an allergy attack, you can also sort of stick your finger into the ear and then pull on that point to sort of open up the lymphatic system. Another thing you can do if you have sinus pressure is take your hand and sort of cup your hand over the ear to going to sound pretty loud, so if you're about to go to bed, maybe don't try it. But if you have a lot of sinus pressure, just sort of cupping your hand over and then just kind of slapping. What that does is it sort of creates a tympanic effect inside the eustachian tube and helps to kind of vibrate things on an inner ear level. So it helps to kind of move things along and get the lymphatic system going. So I would do both ears at the same time if you're at home doing this yourself, and just sort of feel things moving, Tom? Mm-hmm. Yeah. So you can easily do that at home if you have some sinus congestion. All right. Nice. So next we're going to do the thalamus point. This one is located at the base of the concha wall, which lies behind the antitragus. To detect this point, follow a vertical ridge which descends down the concha wall from the apex of the antitragus. It's located on the internal surface behind the antitragus, where the concha wall meets the floor of the inferior concha. This master point represents the whole diencephalon, including the thalamus and the hypothalamus. It affects thalamic relay connection to the cerebral cortex and hypothalamic regulation of the autonomic nerves and endocrine glands. The thalamus is like a preamplifier for signals sent to the cerebral cortex, refining the neural message and eliminating meaningless background noise. The thalamus is the highest level of the supraspinal gate control system, and so it's used for most pain disorders, acute and chronic, and is frequently used for auricular acupuncture and analgesia. It also reduces neurasthenia, anxiety, depression, schizophrenia, overexcitement, sweating, swelling, shock, hypertension, coronary disorders, cardiac arrhythmias, Raynaud's, gastritis, nausea, vomiting, diarrhea, constipation, liver disorders, and gallbladder dysfunction. In TCM, the thalamus subcortex point tonifies the brain and calms the mind. In the Nogier phase system, the phase 2 thalamus is located in the region of Shen, and the phase 3 thalamus is located in the region of the lung. These 3 points, thalamus, Shen, and lung, are all used for drug detoxification. All right. So the thalamus point is sort of right at this underneath region at the bottom of the concha here, the concha ridge. So let's feel around for that one. All right. So if you're at home, what would suffice would be to sort of pinch this region right here. So just pinching this region activates that thalamus point. And this is probably pretty tender on Tom. Mm-hmm. Quite tender. Okay. All right. So we're going to go ahead and place an ear seed on the thalamus point. Okay, so this is another one of those hidden points that's sort of on the inside of the ear folds. So right at sort of like the highest point of this lower concha part, the point that kind of like juts up a little bit. And so right behind that is the thalamus point. And that one is probably one of the most potent ear points, along with Shen and sympathetic autonomic. So I often do all 3 of those together during a treatment. Okay. Okay, so next we have the endocrine point. This is on the wall of the intertrachetic notch, And this master point brings endocrine hormones to their appropriate homeostatic levels, either raising or lowering glandular secretions. It functions by activating the pituitary gland below the brain. The pituitary is the master gland controlling all other endocrine glands. It relieves hypersensitivity, rheumatism, hyperthyroidism, diabetes mellitus, irregular menstruation, sexual dysfunction, and urogenital disorders. It has an anti-allergic, anti-rheumatic, and anti-inflammatory effects. In TCM treatments, it reduces dampness and relieves swelling and edema. All right, so the endocrine point is another hidden point, sort of at the lower edge of the end of the concha here. So right there. So let's feel around for that one. Okay, so this one will be right around there. Is that tender? Okay. So that one is sort of right in through there. Okay. All right, so we'll put an ear seat there. So that was the endocrine point. Next we have the master oscillation point. This one is at the underside of the subtragus, internal to the inferior tragus protrusion. This master point balances laterality disorders related to the left and right central hemispheres. Anatomically, it represents the corpus callosum and the anterior commissure. The point is active in those persons who are left-handed or mixed dominant in handedness, whereas 80% of individuals show ipsilateral representation of body organs, which means same side. 20% of patients exhibit contralateral representation of the body organs. These individuals are viewed as oscillators in the European School of Auricular Therapy, and this laterality dysfunction is labeled switched in some chiropractic schools. Stimulation of this auricular point in oscillators is often necessary before any other auricular therapy treatment can be effective. After stimulation of the master oscillation point, auricular points that were initially more electrically active on the contralateral ear may become more conductive on the ipsilateral ear. This point is used to alleviate dyslexia, learning disabilities, and attention deficit disorder. People who have unusual or hypersensitive reactions to prescription medications or autoimmune problems often need to be treated for oscillation. So this one is another sort of hidden point. This one is located sort of at the center of the tragus here, but underneath. All right, so we're going to feel around for it in that point. So the tip of the tragus here, the oscillation point is going to be right under here. Is that tender on you? Okay. All right. So this one is fairly easy to locate, although all of these points sadly are hidden from view on camera. So this is the master oscillation point. And so then next, we are going to do the tranquilizer point. This one is located on the inferior tragus as it joins the face, lying halfway between LM9 and LM10. These zones I don't really pay attention to, actually. This master point produces a general sedative effect, facilitating overall relaxation and relieving generalized anxiety. It also reduces high blood pressure and chronic stress. Okay. So the tranquilizer point, this one is on the face of the ear, sort of right below the master oscillation point that we just did, but on the outside of the ear. So the master oscillation is sort of hidden underneath this tippy top, and the tranquilizer point is going to be right about here. Tender? Okay. Okay. So right there. Okay. So the tranquilizer point right about there. So now if you're at home and just following along with acupressure, a good thing to do it would be to kind of pinch. You could just pinch across the whole ear really, but to stimulate these two master points, you can just pinch this inner part of the ear here. And each time you do it, I would do it on both sides at the same time and just sort of pinch, hold for 30 seconds and kind of feel the difference in your nervous system. If you were to sort of go through all of these areas and pinch and hold for 30 seconds, and then even massage and sort of pull and tug and just give some loving attention to the ear, you'll notice that you'll feel calmer, you'll feel more relaxed, you'll feel more ready for sleep. So definitely don't neglect your ears, my friends. Okay, so the next point is the master sensorial point. This is located in the middle of the lobe, vertically inferior to this location and vertically superior to this location, which we didn't go over first, so just disregard. We'll go over where it is in the picture. It's found at the same site as the eye point. So this point controls the sensory cerebral cortex areas of the parietal lobe, the temporal lobe, and the occipital lobe. It's used to reduce any unpleasant or excessive sensation, such as tactile paresthesia, ringing in the ears, and blurred vision. So I always see this point as sort of like the earring point. So it's kind of right in the center of the lobe where you would get your ear pierced. So if your ear is pierced, and that's okay. The energy of your body just sort of moves around a piercing after you've had it in for more than a few days. So just kind of feel near that and feel if there's any other areas that are active around where you have your ear pierced. Obviously take your earring out first if you have one in. And we are going to feel around the lobe. So this point is going to be sort of right there. Is that tender? Okay. So that is the master sensorial. Okay, so this one is sort of right there. And at home, obviously, you can just pinch the center of the lobe to stimulate the master sensorial point. It's a really good one to calm the nervous system. So, okay, so the final point we're going to go over today is the master cerebral point. This is located where the medial earlobe meets the face. It lies vertically inferior to the intertracheal notch. This master point represents the prefrontal lobe of the brain, the part of the cerebral cortex which makes decisions and initiates conscious action. Stimulation of this auricular point diminishes nervous anxiety, fear, worry, lassitude, dream-disturbed sleep, poor memory, OCD, psychosomatic disorders, and the negative pessimistic thinking which often accompanies chronic pain problems. Okay, so this point is sort of on the inner edge of the lobe here, the part that's closest to the face. So this point is going to be sort of on the edge of the lobe. Tom's got an attached lobe, kind of. So this one is going to be sort of right in through there. Tender? Mm-hmm. Okay. All right. So that is master cerebral. To review, we had Shen at the upper outer edge of the triangular fossa here. We have the allergy point sort of on the apex of the ear, but on the inside here. Then we had the sympathetic autonomic sort of in this area here. Then we had the 0 point, which is in the center of this ridge here. Then we had the thalamus point here. We had the endocrine point here. The master oscillation point on the inside here. And the tranquilizer point here. We had the master sensorial and master cerebral. So these 10 points would be a good guide map if you're at home, just to sort of focus on these areas. What you can do is sort of pinch along the, inner edge and outer edge of the ear and just spend some time massaging, giving yourself some love and attention, helping to communicate to your nervous system that it's okay to relax, it's okay to unwind, and it's okay to chillax, man. And if you're doing acupressure at home, I would definitely use both hands on both ears at the same time. I would also fold the ears down. You can sort of press and fold, pull. You can stick your finger in and pull up on the ears. You can pull down on the lobes. All of it is direct communication to your nervous system. So it's all good. There's no point that you could do on the ear that would cause any problems. Only solutions are found in the ear. So the ear points and all acupuncture points actually are what we call adaptogenic. And so they work to increase what needs increasing and decrease what needs decreasing. So you can't go wrong. You can't hurt yourself doing this. And give yourself some love. So I hope that was helpful. And you can leave these on for about 3 days. Okay, Tom? Mm-hmm. Okay. We'll see you next time.